illness with similarities to SARS has healthcare workers around the world, including here in Canada, on alert.
In the middle of an active cold and flu season, public health officials are now tracking a possible epidemic after a new virus with pneumonia-like symptoms was discovered with links to a market in China's Wuhan province.
We are continuing to monitor the outbreak of the mysterious new coronavirus.
January 31st is the first time COVID-19 actually shows up on British soil. And it came by way of a couple who flew over from China to a hotel in York. Now, can you imagine how they feel right now? That is insane, knowing that you were responsible for the deaths of so many others. Now, that could be harsh saying that they are directly responsible, but in terms of the journey in which it took to come here, they will feel somewhat accountable. That's got to sit deep on your conscience. I don't know how I would feel if that was me, if I brought it here and then people died. Whoa. Whoa. But before it even got here, we knew about COVID-19. We knew about coronavirus weeks, months before it got here, but we didn't care. And the reason why we didn't care is because the people that it was killing and affecting, they didn't really look like us. It didn't really sound like us, and their culture was very different from ours.
3 patients.
45 people.
56 people have died.
More than 80 people have died. And at least 132 people have died.
Trains, planes, buses, cars, almost nothing leaves or enters Wuhan.
It was easy for us to distance ourselves from them and label them as just crazy, bat-eating Chinese people. Because that's pretty much what happened. You just saw lots of articles, whether it was online or if it was in the papers, it was just Chinese people eating bats. And that is pretty much what the narrative was. They just eat bats over there and they got coronavirus. They pretty much deserve whatever they get, you know? They kind of brought it upon themselves. You know, even Chinese people over here that were born here, never even been to China, we were looking at them differently. If they coughed, just a normal cough, just a dry, tickly cough, we were like, oh, you're Chinese, you must have corona, you know? And you got someone else of a completely different ethnicity who probably did have coronavirus, coughing all over the place, and it was okay. You know, they're not corona-looking people. We delude ourselves into thinking that corona picked a type of person based on the color, the race, the culture, the religion, the sexual orientation. Apparently, coronavirus was biased towards Chinese people. Like, no, corona does not care. It's coming for you no matter what. And we soon realized this when we heard about it in Italy. We was like, what? Italy?
There have now been more than 10,000 people infected with the virus in Italy.
All of Italy is going on lockdown.
Countries such as Italy and Iran are in the middle of the battle. Elsewhere, the impact of COVID-19 is just beginning.
Italy? Like, I know Italy. I've been to Italy. I can pronounce, you know, Italian towns and cities. This is becoming a little bit more real, a bit more serious. I enjoy pasta, I eat pizza. I'm more familiar with the culture, with the people. They more look like me and sound like me. All of a sudden, Corona's created a whole different picture. It's not looking so Asian anymore. It's not looking like an Asian virus. So our minds slowly start to change, but not enough, because we still separate ourselves as being British citizens and saying, oh, I see, it's a European problem. You know, it was an Asian problem, now it's an Asian and European problem. Neglecting the fact that we are European. But that's a whole nother Brexit conversation. Let's not get into that. But then when it does come here, we still find a way, this is what surprised me, to then find another category to distance ourselves from any kind of social responsibility. And what we decided at this point was to say, oh, it only really affects old people. It's an old people's problem. Again, nothing for me to really worry about. It's nothing to do with me. That really surprised me. And if you heard recently that it's now been 3 days in China since anyone has died from coronavirus. 3 days. And I'll tell you why that is because the way they are raised, their ideals, it's about the we and not the I.
The centre of the outbreak are overwhelmed with patients.
And they are now building not one, but 2 specialist hospitals.
Whereas over here it's about the I and not the we. Now I'm not saying we should all just adopt a communist style of living, but there is something to be said that in times of pandemic or in times of risk and of need, that type of ideal works better in terms of working towards the greater good, working for the we and not the I. And then you see what happened in Italy, and you see what's happening here. Our numbers are going up, but their numbers are going down. And you think we don't operate on an I, then just your local supermarket and then try and tell me differently.
Well, just a crazy scene at a grocery store where toilet paper has been in high demand.
Yeah, surveillance video shows a stampede of customers clearing the shelves.
Fights over toilet paper.
In any case, what the joke of it is that we had our first few cases of coronavirus over here. It had already killed thousands and impacted and infected tens of thousands. So we had a head start. We already knew what this virus was doing, not in terms of the scientific breakdown, but we knew that it was fast moving. If you didn't act efficiently, we knew this before it came here.
How serious is this? Is this something that we need to be terrified of, or is this overblown, or how do you stand on this?
Well, first of all, you have to understand the timing of it in the sense that it's just beginning.
I think we're in the middle of a massive experiment. Will people listen to scientists?
Today, the World Health Organization officially announced that this is a global pandemic.
And yet, by the time it got here, because we were so neglectful, because we didn't care, because we kept distancing ourselves from the virus, by the time it got here, it was as though it was the first time we had heard about it. We were so ill-prepared. It was shocking how ill-prepared we were. The only advice we had was to just wash our hands. That's something I do anyway. It's something you should be doing anyway. But that's the only advice we had. It was like Corona just came out of nowhere. Like, what? What Corona? Who's Corona? I drink Corona. No, coronavirus. We all knew about it, but we did nothing about it because we distanced ourselves. So we ended up punishing ourselves through our own neglect. That's something to think about. Really, it's something to think about. How we do not look to operate on a level where we are in it together. We'll always find a way or a subcategory to distance ourselves from having to be involved. And by March 5th, we get our first reported death in the UK. And it's around this time that the World Health Organization has officially labeled this as a pandemic. Italy, everything's gone through the Pantheon roof. They're on complete lockdown. And still, we haven't made any serious movements, any serious actions. We've seen the meme of Boris Johnson.
Some of you may die, but it's a sacrifice I am willing to make.
It was only by March 16th, that's 6 to 7 weeks. 6 to 7 weeks after the first case of coronavirus being in this British Isle, that we get the recommendation for social distancing, and finally this week the schools are closed. 7 weeks to do what other countries had been doing weeks ago. We'd seen China adopt this measure immediately, and we'd seen that it was making beneficial progress. It was working. We saw it, and yet it still took us 7 weeks to adopt that same method. It just goes to show again that we look at government officials at times like this for help, for guidance, which is predominantly what they're there for, but the way government is actually set up is actually not set up for situations like this. It's not. And if you think about it, how we are is a reflection of how they are, and how they are is a reflection of how we are. And we're expecting them to operate and work on a different level to us, but they're human beings just like us. And the reason why I say this is because you go through your social media, you're going through the papers, and people are like, what is this government doing? What is Boris doing? He doesn't care, blah, 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 blah. Well, you didn't care. You didn't care either. We elect government officials to be a representation of us, and they're doing a great job of that, because what I see when I switch on the TV or I look on social media and I see what our government doing is what I also see when I go into our local supermarkets and I see that everything is completely empty. They are not caring about us, and we are not caring about anyone else. Who are you caring about when you fill your trolley with everything, knowing full well that you are fit, you are able, you are strong, you are healthy, and you are young? Knowing full well that, you know what, there's going to be an elderly person or somebody that has bad medical conditions that's going to be coming out just to find an empty shop. Which means they're going to have to expose themselves again to come out and try and find the products that they need, that you could have quite easily come out and got yourself plenty of times. If we wasn't all stockpiling, there would be no problem. The problem is once you start stockpiling, that everyone else starts stockpiling. It's a domino, it's a knock-on effect. And for those who make the argument to say the flu kills more than COVID-19 has, it's completely missing the point. The argument isn't about whether it's killed more or not. The argument is about the trajectory of this flu, of this COVID-19, and the knowledge that we hold about COVID-19. When it comes to the flu, we're already very well equipped in the sense we know its death toll, we know the seasons that it's most prominent, we know what medications to use to be able to fight it. We are fully resourced in terms of our frontline responders, our doctors, our nurses. We know how to combat this flu. With COVID-19, we don't have that luxury. We don't know anything. We're learning on the job. And if you look at the numbers in Italy the other day, 475 people died in a day, in one day, 2,000 in 1 week. It's these kinds of numbers, that kind of trajectory combined with lack of knowledge, that is the concern. That is the worry. When you look at 1918, you look at the swine flu or the Spanish flu, killed up to 30 million. 30 million, predominantly due to lack of knowledge. We did not know and we did not understand how to deal with it and how to stop the spreading of it. Granted, it was around World War I, so you had a lot of movement, but we have a lot of movement now. We have a lot of movement now just naturally because of the way technology has evolved, and we have aeroplanes and we have all these different ways of methods of traveling. If we do not get a handle on this and understand that this is a we issue and not an I issue, this is only going to get worse. And I'm not fear-mongering here. I'm talking to your social conscience. Everything that's been said has already been said about the science behind this particular flu. Pretty much we're all recycling the same information at this point, but there's a conversation that needs to be had about how we operate as human beings on a social level.
Declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
The virus has now spread to Japan and Germany.
We now have a fatality in the Philippines.
The virus is quickly spreading across the globe.
The coronavirus has hit the UK.
More than 360 people have died.
Now, Hong Kong has recorded its first death, while the death toll in China itself has now risen to 425, and the number of cases has climbed to more than 20,000. Our Asia Pacific editor Celia Hammond.
During a time that social distancing has been correctly recommended to slow down the spreading of this virus, I think it's important to remember that social distancing doesn't equal the neglect of social responsibility. And if anything, social responsibility is more important now than it's ever been before. Like, if you're young and you're healthy, then thankfully COVID-19 by and large will not affect you in any serious way. But unfortunately the same can't be said if you're elderly or if you already have medical conditions. And while there are obvious ways in which we can do things to help the vulnerable, there's also things that we can be doing to make things a whole lot worse. Going in front of supermarkets and starting riots and fights, or going inside and bulk buying for yourself only means less for others, and more importantly, less from the vulnerable that actually need it. It increases the amount of times that they need to come out, increasing the chances of them catching COVID-19, which is going to have a devastating impact on them. I think it's time we all do our part. The goal is to simply flatten the curve, to slow down the spread of the virus so that hospitals can handle the patients that they already have. So just stay indoors. Prevent the unnecessary spreading of this virus so that COVID-19 and its symptoms are less likely to spread. You have to remember that you don't even have to show symptoms of COVID-19. You could have it and show no symptoms and still be spreading the virus. We saw that with Idris Elba. He tested for it and he didn't have any symptoms. So just stay indoors. Know in your heart that you're doing your part to not overload medical professionals, emergency services, airlines, critical infrastructures, so that people who actually need these things can access them. There's not going to be a single person that can achieve the slowing down or prevention of COVID-19 by themselves. But if we all act correctly, humanely, with a social conscience, then collectively we can make a big difference.